Good afternoon. I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. I'm Councilmember Cam Gordon, Chair of the committee, joined today by Vice Chair Andrew Johnson and committee members Jacob Fry, Lisa Bender, and Elizabeth Glidden, and Alondra Cano. We have two items today, one consent item and one discussion item. First, I'll move the consent item, which is to authorize application to the Bush Foundation event sponsorship program for up to $50,000 to support the City of Minneapolis' third annual Community Connections Conference. We can pull that if anybody would like to for discussion. But seeing none, I will then move that for approval. All those in favor, please say aye.
Aye.
Any opposed? That motion carries then. And our second item is a discussion item on public health emergency preparedness. And we're going to have a presentation, and I believe that Pam Blix will be making that presentation and introducing us to this topic. Welcome.
Thank you, Mr. Chairman and members of the committee. I'm Pam Blix, and I'm the Preparedness Manager for the Health Department. And our plan today is to give you an update about what we've been working on for the past year, and then a little briefing about what we plan to do this coming year. So with that, I'm also going to be introducing the team, talk a little bit about our areas that we're engaged with the community, talk about our assistance center planning. Tony's going to talk to you about some of our exercises and responses for this past year as well. One of the things that I just wanted to call your attention to is that we have a kind of a wordle that's kind of the background that's very faded that you can barely see, but it represents the public health capabilities that were created by the CDC with local public health across the United States. And they are the capabilities that guide our work. And there are 15 of them, and they represent all the areas in which the CDC expects us to do planning and response, and represent kind of a wide variety of activities that we become engaged in throughout our work. One of the things that I just wanted to do a refresher on is just to remind you, since it's been a year since we've been before you, that we are 98% federally funded to do this work. We have all of our staff in our department is trained to respond 24/7. The other thing I wanted to mention about the federal funding is that over time, since 2002, it has decreased about 40%, while the responsibilities, as indicated in those capabilities, have increased. Because we were originally just funded to do work in disease investigation and control, and as you saw in our capability areas, it's expanded into a number of different areas. We also do our work in coordination with a significant amount of partnerships. We contract for services with our friends at Hennepin County, and we maintain regular communication with other city departments, such as 311, the Department of Communications, 911, Fire, Police, Public Works, and the Office of Emergency Management, so that we are able to respond in a more effective manner when the time comes. The other thing that we do on a regular basis monthly is that we coordinate with all other health departments in our region to work together and to reduce duplication in terms of planning and coordination. And then we coordinate with a variety of community groups to ensure that we are out there engaged and trying to build resilience in the community. Our role in emergencies is pretty specific within the city. We are charged with leading in disease and foodborne outbreaks. Typically, in any emergency operations center plans, roles are predetermined to decide what a department will lead or whether they will provide support. And the areas that we do lead in is the disease area and extreme heat and cold events. In addition, the health department role includes those areas in which we are planning to assist in recovery from the effects of exposure to radiation or chemicals through long-term monitoring and support. And then we also have been asked and tasked with in the past to assist with any events where we might need to provide assistance to survivors or family members of an event, such as that with the 35W bridge collapse or the Northside tornado, where in both places, we provided assistance center operations management. Typically in the past, and what we anticipate in the future, is our department will be charged with assisting with vulnerable populations and anything that has to do with people who may need assistance. One of the areas that we are particularly involved with is community engagement. And I just wanted to share with you a number of the areas within the city that have groups that are engaged in community engagement for the purpose of responding to emergencies. And we are part of coordinating with all of those other departments within the city to help make sure that we reduce duplication, but we also ensure that we are coordinated to provide training and support to the various volunteers who are there to assist the city in an emergency. The first group that I'll just talk about a little bit was one that was organized about 1.5 years ago called the Cultural Services Unit, and currently it's managed by the folks in the Neighborhood and Community Relations Department. And they represent about 21 trained volunteers who represent a variety of cultures throughout the city. And they're there to assist us to ensure that we have, in an emergency, people who are representative of the various cultures and languages that may need specific attention in an emergency. The next group is the Medical Reserve Corps, which is managed by Hennepin County, but we have a contract with them to have access and provide services to the city in an emergency, and they represent about 300 volunteers from a variety of health professions that we can call upon in emergency to assist us. The next group is our memorandum with local leaders at 10 community organizations that the health department has organized to train and ensure that we have a good working relationship with from a variety of cultural organizations within the city so that we could call upon them to help us assist get word out about some sort of health event. We also maintain a database with about 500 community organizations in the city that we reach out to regularly. And then the city also has a group organized through the fire department called CERT. It's a group of about 100 trained community volunteers that we can call upon in an emergency. And all of these volunteers that are engaged with the city are there to assist us, but they also need a lot of support and ongoing training and opportunities to become involved. And so that takes a little time and energy on everybody's part. Another area that we've spent a lot of time with ever since the 35W bridge has been in assistance center planning. And one of the things that we have done significantly is to create a regional template for assistance centers so that all of our partners can use the same organizational model to respond if they include it in their plans. One of the key things about that will be that if we call upon our partners to come and assist us, they will have been trained in our plans as well, so that in mutual aid situation, we have people that understand how our plans work and that it will effectively bring people in quickly, and in a situation, in an emergency, they will know how to fit into the city's organization pretty fast. Another key thing about that we are taking advantage of is last year the medical examiner's office in Hennepin County reached out and now has an agreement to serve both Dakota and Scott counties. And so we are making sure under that agreement that we have an assistance center plan that is coordinated using those two counties as well, so that they will be called upon to come and assist us, and we'll develop a memorandum of understanding with them so that we have access to their staff as well. A final thing that we have worked on for Assistance Center planning is we worked with the 311 office to incorporate intake forms for missing persons and survivors so that we can use them after an event to collect information needed for reunification. That's one other thing that we learned after the bridge collapse, is that we had thousands of people calling the city of Minneapolis asking if we could track their loved ones. And we now have a system in place for the use of those forms that we can use in our Assistance Center and use our 311 to take those calls. I just want to talk a little bit about our team in our department. We have currently a volunteer who is working with us to get his master's in public health. And he's not with us today, but his name is Dr. Clarence Gasky. He currently works full-time for Ramsey County as a mental health case manager. He also novelly was a physician in Liberia, and so we have liberally used him for our Ebola response, as Tony will be talking about. We also have Christine Ganem, who is here. And Christine has moved here from Brooklyn in October to be our 4th CD associate. And the CDC associate program is one in which they place people in our department for 2 years with the idea that we're going to train them to enjoy public health so much that they're going to want to spend the rest of their careers in public health. And so this is our 4th associate, and she's with us in preparedness for this year. Our other person is Nick Yates, who works with us half-time as our administrative support person. Then I will just say that I've served in this role since 2002, and I'm currently also the state of Minnesota representative to the National Association of City County Health Organizations, otherwise known as NACHO, NACHO. I serve on the EP policy group for the state in that role, and I'm also the metro area representative to the State Community Health Services Advisory Committee, otherwise known as SHAC, and I'm the representative to that EP group as well. I'm going to be turning this over to Tony at this time. Tony has worked in her position for about 5 years. In addition, she currently serves as a secretary to the board of Metro Emergency Managers Association. She recently completed her master's thesis on reunification following emergencies and disasters. She's also a sergeant in the Minnesota Army National Guard and serves as the Weapons of Mass Destruction Specialist for her unit. So, Tony.
Thank you, Pam.
Welcome.
Thank you, Mr. Chair, committee members. Thank you for having us. My name is Tony Hauser, and I'm just going to provide an overview of some of the events we spent a great deal of time on during 2014. For the sake of time, I'm going to try and focus on the health department's role or involvement. So Operation Water Woes was a tabletop exercise conducted in April that we participated in as a follow-up from the January 2013 downtown water main break. So I know some of you probably remember that day. It was Pam's birthday. So some of the highlights of the exercise. During the exercise, we had an extensive discussion about what it really means to have a do not use order for drinking water and what the consequences are for residents and businesses in the affected areas. The discussion included topics like fire suppression, toilet flushing, and the length of time before buildings are uninhabitable. There was great discussion around public information, including what to say, who should say it, and how the message would be carried. The discussion included the need to be clear, accurate, and not cause public panic and chaos. Operation Raging River was a full-scale exercise and functional exercise that occurred last August, and it was designed to test the capacity of the United States Coast Guard and the city of Minneapolis to respond to an emergency that affected the waterways or port. The public health role in this exercise was a little bit different from all the other participants, and we were tasked with establishing community reception center operations and coordinate mass care operations. So we did learn a lot. A couple of the highlights, we identified that we need a method to survey the metro region about what equipment is available for responding to a radiation incident, and if that equipment is ready to use, so everything's calibrated and cleaned up and packed. We also need to identify the responsible parties for radiation response operations in the city of Minneapolis, and then develop a radiation response plan, which also includes community reception center and shelter operations. So I'm sure you all remember last July's All-Star Game. The health department, along with the participants you see listed, worked together to staff the Minneapolis Emergency Operations Center during the 3 days of festivities. We used the All-Star Game as an opportunity for our staff and mutual aid partners from across the metro to practice the roles they may have during a real emergency. So multiple city departments, along with county, state, and federal entities, including the statewide all-hazard incident management team, worked well together to provide interagency and intergovernmental coordination and decision-making for the event. Participants created a resource tracking system to serve as a template in the Emergency Operations Center, and as a result, finance now has a process for reimbursement and tracking expenditures during an emergency. Also, during the All-Star Game festivities, the Environmental Health Division in the Health Department logged 1,116 staff hours while conducting 180 inspections and spot checks. So I believe that's a little more than their usual weekly numbers. And Ebola. While Ebola has had a devastating effect on other parts of the world, our work here has been more of a cautionary preparation than a response. Kits with personal protective equipment were assembled by our staff and given out to the Minneapolis and Park police departments for each squad car. The kits contained surgical face masks with eye shields, protective eyewear that fit over eyeglasses, biohazard bags, and bandages. We also worked with Minneapolis Emergency Communications Center to develop additional screening for 911 operators to follow if a call they receive involves someone with flu-like symptoms who had also traveled outside of North America. 3 bulletins about Ebola were created and disseminated by us to health department staff, the mayor and council, and all city employees. A little bit later, 2 additional memos about Ebola were created and sent out to city department leadership and to all city employees, and guidance was developed for staff who work with untreated sewage or in sewers. We also added a web page to the city website in order to make accurate information about Ebola readily available. And we also had staff participate in many community forums around the metro area, not just in Minneapolis. So we are continuing to coordinate with Hennepin County Human Services and Public Health Department on active monitoring activities and behavioral health. Even though Ebola has not reached Minnesota or the United States, we are the home to a large population of people from West Africa. Many of our residents have lost multiple friends and family members, and the psychological impact of Ebola will be long-lasting. So as you can see in this timeline, the incidents our department has responded to have grown over the years. both in number and in scope. While our primary mission still remains to prepare and respond to biological incidents, events over the last decade have demonstrated that we have responsibilities to provide for the safety of the residents and visitors in our city. I'm going to turn it back over to Pam.
We are busy assisting our public health partners for a number of full-scale medication dispensing exercises as part of a CDC requirement for our CRI, City Readiness Initiative jurisdiction, which is pictured there on the map. It's the new MSA area for the metropolitan area. This past year added a couple of additional counties, LeSueur, Sibley, and Mille Lacs in the northern area. Our staff will be participating as volunteer victims and will be seeking other volunteers to help simulate an actual event June 24th through the 26th. Christine will be working on her project to develop a plan for our response to a radiological event, and we will continue our support of Hennepin County to help run the Community Reception Center in preparation for an accident at the Monticello nuclear plant. We will be working with the Red Cross and the City Office of Emergency Management to finalize the department's role in shelters and develop our plans for that role. Clarence Yaski has decided to stay with us to complete his capstone project for his master's degree, and he will be looking at our gaps for children and mothers and make some recommendations for us to fill them. And it is highly likely that we will receive some funding for Ebola from the federal government, and it will be targeted towards developing communication plans, isolation and quarantine planning, and training for personal protective equipment, and then exercising for all of the above. There will be also funding for active travel monitoring, which we will probably identify and to go to Hennepin County because we are contracting with them to provide that service for the city. We have an upcoming community event that we've invited all of our memorandum of understanding partners and our community to, and we're happy to have you include that to send out in your newsletters as well. We have identified weather as one of the primary issues that affects the city, and so we'll be talking about climate change and the potential for it providing additional severe weather, as we all noticed from our flooded streets last June. And so we'll be talking about the impact of that as well. And then we're available to answer any questions.
Question, Councilmember Johnson?
Thank you, Mr. Chair. I have two questions. The first, so 98% of the funding is federal funding. There's been a 40% decrease in federal funding, you mentioned, yet an increase in workload or responsibility. What has the impact been on your ability to handle things or outcomes? Or, I mean, are we stockpiling less vaccines because we have less funding? What's the implication of the 40% less funding?
Well, I guess, and let me call upon my friends and family to assist. Do you want to talk about that? Gretchen, Becky, maybe help me out here.
Sure. I don't have any numbers at my tip, but I think generally it's meant that we're doing more with fewer people, because a lot of the effort, Mr. Chair, sorry, a lot of the effort that the federal government funds is a planning effort, It's really not the doing part. And so we have more expectations, more planning expectations, and less people to do it. As you see, we have a very collaborative approach across the metro area and with other departments and agencies within the city. And so we just had, and they are all experiencing the same kind of cutting back. I hadn't had it described quite so pointedly as Pam did for the presentation here. I am going to Washington as part of, I'm on the national board that she serves on, the public health emergency group of National Association of County and City Health Officers, and we're going to the Hill, and I'm supposed to prepare a fact sheet. So I'm definitely thinking of a little graphic that I can do about the number of expectations and the amount of funding. In addition to that, we've also repeatedly pointed this out to the state, that local public health is quite vulnerable in terms of its ability to respond. There's no state money at all invested in this effort. And it's something for you to note as well in terms of our ability to help the city should the funding partners, the one funding partner step further back from the table.
Sure, and I think that it would be, thinking about that and what the potential impact of that funding, I mean, I could certainly see how that might drive both our team and other teams in the metro, maybe to consolidate around just doing some exercises together rather than individually, or maybe plans that are more broad and cover a larger area. But if there are any gaps as a result of that decrease in funding, if we can identify those and then potentially, make that part of our legislative agenda, or try to find ways to improve our capabilities, I think that would be a wonderful way to go. And then I did have one other question. I was going to ask, who gets to pick these operation names? How do you come up with that? Raging River and all.
Generally, as you just pointed out, we do our exercises in a collaborative manner, many times with many partners. And it's for an exercise like the Raging River, that was a year-long planning process that went into effect that involved a team of, 20 people from a variety of agencies, and they just discuss it. So if you have any suggestions for any upcoming wild ideas, feel free to let us know.
I'll be sending an extensive list to you later. Thank you.
It's always a discussion.
Well, I actually do have one idea, but first I wanted to ask about the local leaders MOUs. You said there's 10, and I was, at least I'm curious, and maybe other committee members would be curious, and others to know, who are the 10 local leaders, and could we
Who
find
are the
that
10
out online?
organizations?
Yeah.
So, man.
And if you don't know them offhand right now, you could also send that to us, but why don't you see if you can come up with them?
Let's see how I do.
Okay.
Little Earth, Sabathani, Urban League, SEAC, which is Southeast Asian Advisory Committee, Clues, Pillsbury, United Services, East Side Neighborhood Services. How many more do I have to get? Seems like I'm getting close.
We've got 7 so far.
Yeah, we'll send them to you. But each of them have identified, each of the 10 have identified 3 leaders that we maintain relationships with them. So, yeah.
Well, so I think you were short by 3, so maybe you could get us the list. And then I was curious if there were other agencies or groups or organizations who are interested in building this relationship. Are we open to expanding the number?
Absolutely. It's just a matter of, we don't want to maintain a huge list of people, but we want to, make it a positive experience for them and something that we can commit to maintaining. So we don't want it to be a cast of thousands, but
I appreciate
absolutely willing to take a couple more.
Yeah, okay, I appreciate that. The last thing I wanted to ask about, and maybe this would be something for another tabletop effort. It's a concern that I've had and heard about more in my area of the city, which is the increase in the number of oil trains.
Yes.
Trains carrying crude oil, and there's been some explosions and some spills. I actually attended one large meeting where the railroads, the fire departments, and the state officials were there, and probably some folks from the health department were there. But just kind of talking about it, and we don't have a lot of resources in the state even to respond to these, and I worry about it, and others do. There's also problems with our train bridges that don't really get inspected by the city, and who's inspecting them, and who even knows what shape they're in, and many other problems. But that's something, I don't have a catchy name right now, but I'll ask Councilmember Johnson to come up with one perhaps. But I think that's something that I'm concerned about. And first of all, you haven't done one of those recently, have you?
That's something that I think the fire department obviously would be the lead to respond to something like that. And so I think it would be, to do a presentation, we'd want to coordinate with them because they're the people that would be the lead, and then we would be there as support for any sort of incident. But I think a briefing, just so that if you think your committee would be interested in kind of hearing about what is the plans that we have in place, but as well as also the potential risks. I think that's something, you should ask Chief Friedel about, and happy to coordinate with him to do something like that.
Well, I appreciate that, but also I'm just wanting to know that our experts are getting together and meeting to talk about it and make sure that we know how we're going to respond, and assessing, do we have the right materials to respond with, and those kinds of things. But
I'll just say in my conversations with him is that he feels confident that they are doing training and that they have the types of response equipment to given of course that the fact that if it was a huge explosion, it's not something that they're going to be able to put out immediately.
Right. All right. Well, thank you. Are there any other questions, committee members? Councilmember Fry.
Thank you, Mr. Chair. I just, first off, thanks so much for all the work that you're doing. I had the privilege of getting a really wonderful briefing about a year ago now, or half a year ago, from Ms. Hauser. It was very helpful. So couple of questions. What's the strategy for dissemination of information when something bad really does go down? And I understand it probably would be case specific and geographically specific, but just to use the ward I represent as an example, if something were to happen along the Central Riverfront or downtown, what's the mechanism that you let as many people know as possible?
Well, one of the things that the city has invested in, I will just say, is the same system that we use for snow emergencies,
Okay.
Swift Reach, and that can be geographically targeted, as you probably know from getting the alerts for street sweeping and that type of a thing. And so that can be utilized, and the folks down in the 911 center are very familiar with how to do that. And so if you're talking about something immediate like that, that would be the system that would be getting out to the residents right away. If there was a power failure or something like that, there would still be a need to go out, door to door with the megaphones and that type of thing. And I believe the fire department has plans on how they would implement that. Does that answer your question?
That does. Additionally, I'll just let you know that there's a both condo owner as well as apartment owner sort of index that's being created right now that enables very fast dissemination of information throughout all of the buildings, really on both sides of the river. And there's a couple of individuals that are coordinating the effort. I'll make sure to get you the email afterwards, because I mean, it's basically like a very effective gossip chain, but it can also be used, I think, well for real information that you need. And then a second question just had to do with the likes of an Operation Raging River coming again. I mean, I know, and I wasn't part of the Public Safety Committee meeting where they sort of discussed the topic in depth, but I understand that a lot of times there is an overarching necessity to keep information quiet so that the higher ups can kind of do their job and figure out how to keep the rest of us safe. I totally get that. I guess my question is do you have an idea for what sort of the standard or the breaking point is between which we can't say anything and which we can? Because this was an instance when I knew nothing. And that's not necessarily a bad thing, but do you understand my question?
Sure.
Okay.
I'm not sure why you wouldn't have been in the loop on that. I
Right.
know that when we are the lead for an exercise, I know that like when we had an exercise a couple of years ago for where we disseminated pills door to door in North Minneapolis, we very much had community meetings, and we met with the council members and really tried to keep people in the loop that that's what we were going to be doing, because obviously we didn't want to alarm people. So I'm not sure. I'm sure it varies depending on who's running the exercise and what the exercise actually is. I know that we also do an exercise pretty regularly because we have an alarm system in the downtown post office that that we have to respond to. It tracks whether or not anthrax has been found in the post office, and then we are charged with responding to that. And when that occurs, when we do that exercise here in downtown Minneapolis, I know that the fire trucks have to come with their decon units, and we have to cordon off the area, and so we do regularly notify people that that's going to be occurring as well, not to unduly alarm people again. So
Yeah, I guess just next time around, my ask would be, and this might not even necessarily be that you're the right person to ask, but there were a lot of people in the ward, and specifically in the Central Riverfront, that were really freaked out by the copters that were right next to their bedrooms. And just next time, if it's not essential for overarching safety, that I know about it, I guess.
yeah, and I certainly will mention it to the folks that organized
Great.
that.
Thank you. Appreciate that.
You bet.
Thank you very much, Councilmember. I don't see any other questions or comments.
Okay.
I just want to thank you very much for the presentation and
Thank you
all the good
for-
work that you do all year.
Letting us come. Appreciate it.
And I will move to receive and file the report. Seeing no discussion on that, all those in favor, please say aye. Aye. Any opposed? Motion carries, and seeing no further business before us, this meeting is adjourned. Thank you, everybody.
Which comment? Oh, when I see it? Oh.